Morning, our student. Today our lecture about thermal parasite that it will our blood system or tissue. So the helminths worms called blood flux causing disease called schistosomiasis or bilharziasis. Now these flux are reside mainly in the blood vessels of various organs. It is estimated that about 600 million people in the world in 79 countries suffer from schistosomiasis. Now this parasite can cause an intestinal, hepatic, pulmonary, urogenital, cerebral and other form of schistosomiasis according to the site be affected or dwelled. Now schistosome is the only flux with separate sexes as shown in the beneath in this figure. Now the female worm lies in the incofloral canal of the males. This condition is important for transportation. Now beneath you can see this figure can show you the life cycle stages. Started from the egg, now miracidium, then sporocyst, then cercaria or cercarium, then adult worm, male and female. Also there is in adult form oral sucker, ventral sucker, gingival in the male, other tests that can be put here. You must keep in your mind here the 6 be separated, not shaped like as other nematode, at no reader stage found in life cycle, and the effective set is cercaria through direct penetration of skin. Okay, other slides. Now our student, this slide can show you on the left up the male and female and how can be copulated with each other in the mating process, and you can see the gingival canal of the males and the genital of the male and the length and width when compared with each other. It is very obvious. Now you can see the life cycle how can be started from the adult when found in the human, then discharge egg, then miracidium, then miracidium infect snail as intermediate host, then sporocyst, then cercaria, but no reader stage. You must keep no reader stage, and the cercaria exits out from the snail to the environment in water environment and can penetrate the human, the final host, the human being, through skin penetration and lose it by forked tail, and can be matured through its movement during the blood system or circulation to be matured in the venules that surround our GI or our urinary bladder, and can cause disease called bilharziasis or schistosomiasis. Well, beneath you can see the effective stage. Effective stage for definitive host is cercaria. Now definitive host here is human. Intermediate here host here is a snail, and the mode of transmission through penetration of skin by cercaria, direct penetration of cercaria through our skin. Okay, it's very clear here, this shapes. Other slides. Now if we study the life cycle in both human in the left side of this figure slide and the intermediate host, the snail that harbor the larva stages in the right side, you can see the human being when harboring the adult, because it is called final host. The final host will harbor the matured stages, adult form that can reproduce sexually, as you know, as we mentioned that or this fact for you in the preceded lectures. Now in copulation process, the male and female, the female is longer than male and small in width, and the male is rigid tuberculated, its tegument, and have jugular canal. Now, after fertilization, and the site be preceded or dwelled by this parasite, can give miracido, can give egg. The egg can discharge it out through skin, through feces or urine as the species. Now to the environment, now to miracidon free living, now enter the snail, and then form sporocyst, circaria, forktail circaria. The forktail will penetrate the skin directly through circulatory system to reach its site. Bye. So the life cycle here is very clear, and it is very clear. The shape of the egg is very clear here. Other slide. Now there are 5 medical important species, which are Schistosoma mansoni, Schistosoma hematopium, Schistosoma japonicum, Schistosoma intercalatum, Schistosoma mekongi. All these can cause intestinal schistosomiasis or intestinal bilharziasis, with the exception of Schistosoma hematopium, that can cause vesical or urinary schistosomiasis or urinary bilharziasis according to its site be dwelled or affected. Now, intestinal schistosomiasis, first species here, Schistosoma mansoni. About its morphological feature, we can see here in this figure beneath, we can see the female, long female, the position of ovary, anterior half of the body to be situated, and beneath it the male having 8 to 9 testes, the tegument coarsely tuberculated, and the egg equipped with large lateral spine. Okay, beneath we can see the egg from several references, the egg with lateral large spines. Now the male are ranging in size from 1 to 1.4 centimeter in length, and the body is covered by coarse tubercle. It has 6 to 9 testes. Female, its length 1.5 to 2 centimeter in length. The ovary present in the anterior third. Okay. The number of egg being laid is 1 to 300 eggs daily. Uterus here is short, containing few ova. Here this criteria can enable you to differentiate this species from other species of the Schistosoma. Other slide. Now here you can see the Schistosoma japonicum, second species that dwell blood veins that surround our small intestine, our GI, special small intestine, not large intestine as that found with Schistosoma mansoni. Here about the Schistosoma japonicum in the veins that surround our small intestine. Now you can see the position of, in this figure beneath, you can see the position of ovary, the central portion of the female. Now the number of testes 6 to 8. The tegument of male is smooth, not like that preceded, and there is lateral knob, or difficult to say, lateral knob spine, not large, as a knob like be situated laterally. Okay, as shown beneath in this figure. Okay, the female can lay 500 to 3,000 point 3,050 100 eggs daily. Okay, the picture of the egg is clear beneath. Now about Schistosoma intercalatum. This species is rarest and least pathogenic and have terminal spine in its egg. Now about urinary schistosomiasis is very important. Here, ovary posterior half can be in female be positive. The male have 4 to 5 testes, tegument slightly tuberculated, terminal large spine be equipped in its egg is very clear hair obviously can be seen and detected and can be differentiated from other species and can cause disease called vesical or urinary schistosomiasis. Now other slide here about its symptoms and complication. You know our student, the patient whom infected with schistosoma hematobium that can dwell the veins around the bladder will suffer from intestinal hematuria and painful malnutrition. There is an inflammation of the urinary bladder, cystitis, and enlargement of spleen and liver. Here the patient whom infected with schistosoma hematobium. Patient infected, whereas patient infected with schistosoma sonnei and with schistosoma japonicum will suffer from cervical dermatitis, called swimmer itch, and dysentery. You know that dysentery means mucus and the blood in the stool with tenesmus, as well as enlargement of the spleen and liver. Now also in schistosoma hematobium causes squamous cell carcinoma in the bladder. Now when we return on it back on it, laboratory diagnosis. Now in the case of schistosoma mannsonii and schistosoma japonicum, we can diagnose it by direct examination of fecal specimens, not urine, fecal specimen. After consideration cementation method, the egg has characteristic lateral spine. Okay, lateral spine, large lateral spine in schistosoma mannsonii, knob or small sized spine with schistosoma japonicum, as shown here in this figure. Other method can be detected in laboratory. We can use, otherwise we should call it rectal snip. From these two methods we can diagnose and differentiate the correct infection by this schistosoma. Other slide. Now about the laboratory diagnosis of schistosoma hematobium. Now this species can dwell the veins that surround the urinary bladder and can cause urinary bladder or vesical schistosomiasis or bilharziasis. Now it can be done by examination of the urine, not stool. Examination of what? Examination of urine. The sample here that be used to be detected for diagnostic of schistosoma hematobium is urine sample from the infected human being kind. Okay, now after allowing, the urine, after allowing it to sediment in a conical analysis glass, a drop from the sediment is taken and examined for the presence of egg. Now the egg here, our student, characterized by having large terminal spine. Large terminal, not lateral. Terminal spine in the end, not in the lateral side, as that's shown in schistosoma mannsonii and schistosoma japonicum and intercalata, mekonga, other species. But here in large terminal. Other method here can be used also biopsy, by taking biopsy from bladder, because the bladder cystitis be infected and the liver and spleen can be enlargement. So splenomegaly, hepatomegaly, this clinical symptom can be void or associated with such infection. Now beneath you can see the large terminal spine of this schistosoma hematobium at the right side. Now briefly, we can summarize how can we diagnose and make a differentiation between all these species in laboratory, if we can, or if we use an egg stage to be differentiate between these. We can see here in this shape, the upper egg here is schistosoma mannsonii with large lateral spine. Okay, whereas beneath it we can see small knob, lateral small knob, not large, not well, and also lateral position, situated or be adhered laterally, not terminally. Well, whereas beneath we can see the large terminal spine. Look, this referred to schistosoma hematobium, that it will the venous surround our urinary bladder. So we can use the urine sample for detecting this parasite in laboratory. Also, other two shapes here from various references can be as a comparison of 3 schistosoma over. You can see from the left schistosoma masoni, in the middle schistosoma hematobium with large terminal spine, and the schistosoma japonicum in the right small knob spine. It is very clear shaped, and we can use this morphological criteria of the egg and the sample to differentiate between these flags. Now, schistosomiasis. We can call schistosomiasis a disease caused by schistosoma masoni, japonicum, or hematobium. Now, it is a duplicate parasite of human and snail, human final host, snail as intermediate host. Now, eggs are passed in the urine or feces as the species and hatch in the natural water. Miracida hatch from the egg, penetrate suitable snail and develop 2 generations of sporocytes. Now cause cercaria. Cercaria penetrate the skin when a new host, we mean our human being, host come in contact with the contaminated water. When the cercaria penetrate the skin, they shed their tail, yes, lose the tail, forked tail, and become schistosomal. That then migrate through the tissue of the liver, male and female flax, copulate with each other and migrate to either to gallbladder in schistosoma hematobium or rectal, where eggs are laid in the case of schistosoma japonicum and masoni. Now the sign: fever, skin rash, abdominal pain, organ enlargement. Well, schistosoma scar resulting in chronic liver, spleen, and bladder damage. Okay, the axis mean laboratory urine or feces, the egg can be detected. Now, treatment can be used praziquantel, albendazole, mebendazole, prevention adequate sewage treatment, parasite control using predator sensor. Okay, related to schistosomiasis disease here is very important. Is swimming itch. Human are not the definitive host. So, as parasites penetrate the skin, it unable to complete its life cycle migration, then it dies, leaving a small inflamed papulae. Here is mean the swimmer itch. See you.